the opportunity today and to walk you through hopefully some steps on how you can support your team if they're experiencing a crisis. So, before we hop into kind of discussing our goals for today and our agenda, I always like to give this disclaimer at the beginning, as in that we will be talking about different crisis situations. And so, if you need to take any space or need to take any break away from the content potentially, please feel free to do so. And we will be able to share the recording with you afterwards and some resources as well. Now, kind of taking a look at what are our goals? How can we help you get the most out of our time together today? So, we're going to initially start with defining what a crisis even looks like in the workplace and what are the impacts on not only the organization, but the people that make up your team. We'll also take a look at what's your role in the crisis. How can you support pre-crisis, during a crisis, and then after? Then we'll transition into talking about why should we even prioritize mental health, right? How can this crisis situation potentially impact someone's mental health? And then we'll talk about actionable strategies. What are some actual support strategies that you could put in place to help your team? And then, of course, we have a great resource that is a great crisis response plan that we will review as well. Now, just a reminder again, if you have any questions, please feel free to use our Q&A chat that we have, and then Mackenzie will be sure to let me know what the question is, and we'll have space to be able to answer them. So first, if you do have the opportunity to pull out a phone or an additional device, or even open up a separate tab from the webinar, we will take a couple polls throughout our time together today. So you can access these by either going to pollev.com, and there you'll enter Alicia Trout 566. So that's my name, spelled ALISA TROUT 566. And then if you decide not to use the online option and you'd like to text, which the text option is typically pretty popular amongst our groups, is you would text my name, Alicia Trout 566 to 22333. So again, you would text my name with the number 566 at the end to the number 22333. And of course, if you are unable to engage with us online in the poll or in the text, please feel free to use some of the messaging features we have here in Zoom as well. So, our first topic that we're going to talk about today, again, is workplace crisis and specifically the impact on our organization and our teams. And we're going to start with a quick poll. Again, these are anonymous. So, our question is, what type of crises have impacted your organization most recently? Your options are A, a natural disaster, B, a violent crisis, C, a health crisis, or D, a business crisis. And there's not a right or wrong answer. It's more so just to understand what has your organization been experiencing recently. So I'm taking a look here, and it looks like we have 55% of our attendees today have experienced a health crisis, or a health crisis has impacted your organization most recently. And we have 33% reporting a business crisis, and then both 8% for a natural disaster and a violent crisis. Thank you all for your participation. So let's define what a workplace crisis is, because surprisingly, over 80% of the US workforce has identified experiencing some form of a workplace crisis. So it's defined as an unexpected event that can threaten an organization's safety, it can threaten their operations, or it could threaten their well-being. So there are different types of workplace crises. One example would be natural disasters. So these can be things like floods. We know that many areas have been impacted by floods lately. Also fires, tornadoes, hurricanes. Those will all count in the natural disaster category for a workplace crisis. And so if we're thinking about those, that might not necessarily impact everyone that's specifically within your organization, but societally, that could potentially impact your operations as well, and potentially people's well-being. Then we have a health crisis, which I know that we are a lot more familiar with more recently, because that would be some examples would be pandemics, infectious disease outbreaks. And then this could also look like workplace accidents or injuries as well. We could also take into consideration environmental hazards and also just chronic illness as a whole could be defined as a health crisis. And then we have business and technical crises. And so this could potentially pertain to what type of industry you're in. So if you're working for a remote company or maybe a tech company, something like a data breach or a website outage or power outages could be a huge crisis for your organization. And then we have things like layoffs and lawsuits, which would fall under that business crisis category. And then we have violent crises. So this could really land on a spectrum when you're trying to define what a violent crisis might look like in the workplace. So it could be something like bullying, violence, threats, and intimidation, but it could also be on the other side of the spectrum where you might have a fatal incident or physical violence. But the reason why, and just to kind of ground us in why it's important to talk about this, is that about 75% of Americans are worried about the potential of a workplace crisis actually taking place. So let's look at the impact of a crisis on the work environment. Because again, I'm sure that we can think in our head, like, oh, yeah, like this might really hurt our workflows. Like this would definitely slow down operations. But let's also think on the individual and team level as well as what that impact might look like. So the first thing would be mental health challenges in the crises can definitely impact and cause an increased stress and burnout for team members. So we might see that in really high pressure environments, potentially before that crisis happens, a crisis could then exacerbate that stress and it could potentially lead team members to feeling burnout, which we know can lead to a disconnection to work and also a huge decrease in productivity. And it can sometimes lead to churn of different team members. And then something to also take into consideration when we think about mental health challenges and the impact of crisis is kind of the generational disparities in stress. So, what we found in research is that typically younger employees are more prone to stress and more likely to take absences or to potentially take days off due to workplace stress. And that's just to note that typically older team members, they are still experiencing the stress, but they're less likely to take off. So they might be more likely to experience some of those burnout symptoms. So having things like mental health programs and access to supportive care could be helpful for both groups, but it's being able, again, to recognize the disparities and what that support might actually look like. Crisis can definitely have a big impact on a toxic work environment if it was already there pre-crisis. So thinking about some of the indicators of toxicity could be disrespect. It could look like non-inclusivity in the work environment, unethical behavior even, and then potentially some abusive conduct, which can contribute to a harmful workplace culture. And so a crisis, again, is just going to exacerbate or reinforce that that culture already exists. And then it can lean on afterwards as well. Of course, a crisis can potentially impact trust, how team members feel about their organization and how they feel about their leadership. So a crisis could impact potentially and cause policy changes. But if there's already a lack of trust from the team there, they might not trust in these new changes or these new policies. They might wonder, well, how are we actually going to actually reach this goal? And we can also see within organizational trust challenges, it can lead to extreme employee disengagement, seeing a big increase there. And also, if we're thinking again for the organization as a whole, we could see financial costs, which could be due to the impact of crisis. And so, because of a crisis, we might potentially have to engage in layoffs, which it might reduce costs up front. But when we're thinking about our workforce as a whole and the morale is typically pretty low after that. And we can also see a decrease in productivity. So now let's transition and talk about what would your role be in a crisis? Like where can you support? Where can you hop in? What are maybe some things that you can have set up now to help your team or your organization through a crisis? And I do note that as an HR representative or either as an HR leader, you have a pretty big task, but there are definitely tools that can help you. So let's talk about HR's impact before a crisis, during a crisis, and after a crisis. So before a crisis actually occurs, when we have that space and that capacity to be proactive, we're able to start looking at policy development. I mean, if you're coming into a newer company, maybe they don't have any process laid out for what different crises might look like and how you want to handle them. Maybe they don't even have a communication policy. Your role could be helping them to implement and to create a policy as well, and then to train team members and leaders. That way they can effectively carry out that policy. Which leads into training and awareness as being a big piece. Being able to really rehearse, reshare, and giving any resources that you can to team members so that if a crisis does happen, they feel empowered to be able to make decisions really effectively and to also feel like they have confidence in their organization as a whole. And then also part of the pre-work is doing a risk assessment, whether that's engaging in drills, which we know is something that can occur, whether it's being able to share different quizzes or things of that nature, like anonymous surveys, but being able to assess for what risks are out there. And then compliance management, which is huge. As an HR leader, you are empowered to lead on compliance and ensuring that your team, again, is following those preemptive steps before a crisis occurs, or at least having knowledge of what to do before that happens. Now, during a crisis, which we know can be pretty stressful, no matter what type of crisis it is, it will definitely have a big impact. A huge thing that's important is team communication, having transparent communication. And we'll talk a little bit later about the steps to having that great open and transparent communication. But I love to differentiate here between transparency and just oversharing because I think sometimes we think, well, I'm being transparent because I'm sharing everything. But what's important, especially during a crisis, is sharing the information that is most pertinent, making sure that it's clear and sharing that information that actually matters. We might know everything that happened and some of the causes to the crisis, but does that impact the team? Do they need to know all the pieces, or these are the specific things that they need to be able to get to safety or to be able to get to that after part? Another key piece that can be helpful during a crisis is emotional and mental health support. Again, you hold a lot of weight on your shoulders as an HR leader. And so maybe being able to work with a different organization that comes in to help when a crisis happens, maybe that's the support you're able to offer. Or maybe you're very into emotional and mental health support. You've done a lot of training with it. And so maybe you've created a program to use in times of crisis. But it's important to note that we just cannot forget about the impact of emotional and mental health during a crisis situation. And then, depending on the type of crisis, having skills to be able to engage in conflict resolution and mediation. And this would apply more so to some of those business, potentially, or technical crises, or even the violence crises, depending on what it is that happened, if it's bullying or intimidation tactics. But as an HR leader, you have to feel empowered to be able to resolve conflicts when they occur. Then we have the after. In the after stage, we're really trying to focus on recovery. We want to help our team and our organization recover. We also want to help them rebuild, right? How are we able to look into the future as to what things might look like for us as a team? So we have to start doing that by assessing, what was the impact? Who was affected? How did this potentially affect our customers or our other streamlines of business? If we have a physical location and it was a natural disaster, what was the impact for us there? What would it take for us to rebuild? And then we have debriefing and learning, meeting together as a collaborative team, meeting with stakeholders, meeting with leadership to decide what worked out of that policy development, what worked from that risk assessment or that compliance management, and what did not work. What do we need to learn? Where can we grow? And then a huge step is actually being able to reestablish or rebuild that trust and morale for those team members. Again, crisis, as we talked about, can heavily impact trust in an organization. And so being able to rebuild that and ensure team members that they are safe, if that's the case, can be really pertinent. And then employee advocacy, which we'll talk about the balance between being able to support a business needs and employees needs. But what's pretty cool and I think very impactful in your role in HR is that you are there to help advocate for the employee. So you're not only there to be able to keep business needs in mind and organizational needs and leadership needs, but a big piece of it is, hey, I want to advocate because I think that this is what employees need. This is what they've told me that they need as well. Being able to set up different systems in place to support that. So let's talk about the very interesting dance that has to be played between balancing employee and business needs. And what can sometimes be tricky here, but is also really important when having that thought of how am I going to be able to do this, is that the balance really lies in being able to prioritize people first, right? Prioritizing people and their needs, but then also strategically aligning the recovery after the crisis with the organization's goals. So again, we are prioritizing what people need, but we need to strategically align it with the recovery with the organization's goals. So, one thing that's important and can feel kind of simple to do initially, even, is just to acknowledge and address the emotional impact. So, having open discussions and open forums with team members to be able to acknowledge that this crisis happened, acknowledging the impact and how it might have affected them, and even validating their feelings about it. Maybe they're angry if it was a business crisis and maybe people were laid off, acknowledging that that happened, right? And saying, hey, we understand that this can be really difficult for you, and giving them space to just share how they feel about that. And of course, there are a few different ways you can do it because we know that we have some team members who love to verbally express. We have some people who would prefer written communication or some people to remain anonymous, but we have to create that space for them to be able to do that. And that's really leveraging the employee needs there. Now, transparent communication is something that, as we've seen and talked about previously, and it will carry throughout this conversation today, but transparent communication is really important. Being able to provide those regularly updates to employees so they can understand where we are as an organization, where are we going, what are recovery plans, what can I expect, but being able to set clear expectations with them is something that can be really supportive and continue to instill that trust. So, an example of maybe you're making recovery plans with teams, or maybe you're making a recovery plan with specific employees, which is great. But being able to set that clear expectation that maybe we won't be able to meet all accommodations, this is what we will be able to do, but being upfront about that instead of potentially having the employee waiting to see maybe that they would be able to receive that accommodation, or they could then move forward and try to problem solve in another way. Again, as well, being able to encourage and establish modalities to have that two-way communication is super helpful in reinforcing transparent communication for your culture. So setting up Q&A sessions, potentially with leadership. You can also create anonymous feedback channels like surveys to, again, to be able to meet everyone's needs and where they are. Also being honest about challenges, showing some humility there and being able to talk about how those challenges might either impact their role or impact the organization. And then also using the right tools is something that could be super supportive in setting up transparent communication for your company. And so that's maybe using maybe Slack if you have a Slack culture, or using Teams to be able to provide quick updates. Or if you use a project management tool, which can actually give visibility to other team members into these are our priorities right now, this is what we're focused on. They aren't left in the dark and wondering what's coming. Something else when trying to balance employee and business needs is that step of being able to learn and prepare. So, taking that information that you're learning from employees as you're acknowledging and addressing emotional impact and doing different assessments, but then being able to prepare for the future. Also, you want to be able to recognize and rebuild. Recognize what has happened, what is happening, and then focusing with the business to say, how do we want to rebuild? What's our next? What's our next little small steps before we're able to get to that next big goal? We also, which is so tricky when trying to balance both business and employee needs, is supporting productivity without pressure. And we want to be able to support the employees' needs, honestly, to not have pressure in their work environment. But we also need to foster and support that business need of having productivity. And so we want to be able to encourage high performance while maintaining a healthy, pressure-free work environment. So what that can look like, I mean, prioritizing well-being from the jump, having flexibility if you can in the workday. Prioritizing well-being could offer maybe different workshops or offering little tools if you live in a physical office of posters or spaces to be able to take breaks and really making that really prominent. Having trust and psychological safety is also a good way to have that support productivity without pressure. There are great tools and resources for efficiency. Maybe it's having trainings about time management. Do you have a system where you can maybe utilize some automations to make workflows a little bit easier so they can focus on other tasks? Great. Or can leadership take a look at workflow improvements that might help team members as well to be more productive without feeling that weight and pressure of them needing to figure it out themselves? Also, recognizing and rewarding effort. So, not only do we want to recognize those big moments because we obviously need to celebrate the big things that happen and the wins and the small wins as well, but we want to look at the effort. So maybe it's thanking someone for taking some extra time and looking at specifically that project, or maybe they helped a teammate in doing something, but really celebrating that collaborative work and that effort. And of course, the last piece in being able to imbalance employee and business needs is really that gradual transition to normalcy. So being able to support an employee with recognizing that things do have to come back to normal and offering them resources that's within the business's purview of what they can offer. So let's talk about now mental health in crisis situations as well. What does that look like? And we will also talk about a little definition of mental health, like a really little mental health 101 about it as well. So let's start with a poll, and this will be our last poll for today. How many US adults experience some type of mental health challenge in the course of a year? We have A, which is 1 in 3, B, which is 1 in 5 adults, C, which is 1 in 6 adults, and D is 1 in 10 adults. Okay, so it looks like we have a winner at 80% of 1 in 3. Okay, but then we have B in second place at 19% with 1 in 5. It looks like no one was checking for 1 in 6 or 1 in 10, which is okay. So let's see what the answer is. The answer is actually 1 in 5 US adults experience some form of mental illness or mental health challenge over a 12-month period. That is 1 in 5. So for the 80%, I believe, that chose 1 in 3, you're not off there because that's actually the global statistic. So globally, adults experience some form of mental health challenge within a 12-month period at a 1 in 3 rate. So about 30% of adults. So, what that means, it shows how impactful mental health is and how prevalent it is in our country today. So, just looking at the breakdown of, again, it being 1 in 5 adults, or around 21% of adults, looking at the highest population within that, 44% of lesbian, gay, and bisexual adults are experiencing some form of mental illness or mental health challenge that's impacting them over a 12-month period. When we break down a little bit further and look at the actual mental illnesses that are reported most frequently, we have anxiety disorders at 19%, which we'll define anxiety actually in our next slide. We then have depression, which is experienced at 8%, or at least identified for adults as experienced at 8%. And then we have dual diagnosis and post-traumatic stress disorder, which share that third place for 4%. So again, there's a pretty big impact here. So let's talk a little bit about adjustment disorder and anxiety disorder. And I wanted to talk about adjustment disorder, one, because it can be really prevalent after a crisis. And it's pretty prevalent actually in workplaces as well from the research that we've done at TABA. And then we also have anxiety disorders, which we just talked about was about 20% of the mental illnesses that are experienced. So adjustment disorder, it's prevalent. We have 5 to 20% of outpatient mental health visits are typically have a diagnostic code of an adjustment disorder attached to it. And then that's actually our top diagnostic category for TABA as well, is an adjustment disorder. So what is it? It's an emotional or behavioral reaction to a stressful event or change in a person's life. So again, just to note, it's due to a change in someone's life or a stressful event. Now, what makes this different than potentially experiencing some acute stress or potentially some more normalized or normative stress we might experience after a big event is that it still persists within 3 months of it happening, right? It's not that like I experienced this crisis. I might have experienced some sort of symptoms after, but after maybe a few weeks or a month, I've been able to kind of return to my functioning. But if someone is struggling with adjustment disorder, they're not really able to return to their normative functioning. Maybe family members, peers, or even themselves, they're able to notice that they're having a hard time adjusting to the change. And then we have anxiety disorder, which is actually our second highest diagnostic category at Tava, but it also accounts for 71% of our clients' intake identified challenges, which is pretty high. 71%, that's pretty big. And an anxiety disorder is a mental health disorder that's characterized by feelings of excessive worry, anxiety, or fear that are strong enough to interfere with one's daily activities. So, again, just to normalize, we all experience worry, we all experience fear, we all experience different bodily experiences that we can relate to anxiety. But the key here when making that diagnosis and being able to say, like, oh, I think I have an anxiety disorder, is that it starts to impact my daily functioning. So maybe I'm avoiding different areas of my life. Maybe I'm starting to engage in some different or maladaptive coping strategies when being introduced to that trigger. But again, it's really impacting how I function on a regular and daily basis. So, something that also impacts our mental health because only 53% of people are actually receiving treatment whenever it comes to being diagnosed with a mental health illness or either recognizing that they have a mental health challenge. But a big barrier is stigma, which I'm sure is something that exists in some workplace cultures. Of course, trying to change it can be difficult, and we have supports for that, but it's something that does exist. So, stigma, as defined by the World Health Organization, is a mark of shame, disgrace, or disapproval that results in an individual being rejected, discriminated against, and excluded from participating in a number of different areas of society. So, there are three factors that combine to really help and reinforce that definition of stigma or that experience, someone might say, if they feel like they're experiencing stigma. So, the first one would be stereotypes. Stereotypes are that initial thought potentially that we have about a person, a group, a thing, a topic, an idea, but it's that initial thought. Prejudice builds really on that initial thought and that stereotype, and prejudice is our attitude towards a thing, a person, a group, or an idea. And then we have discrimination, which is the action then. That's a specific act against a specific person, a group, or an idea, which is based on our stereotypes and our prejudice. So, what that can look like in mental health is let's say that someone has an idea initially like, mental health doesn't belong in the workplace. Talking about mental health does not belong in the workplace. We would say potentially that that's a stereotype that they have. But then what prejudice would look like as an attitude, then maybe a workplace starts promoting, like, hey, we're having a mental health workshop, or we're setting up this mental health space in our office space if we have a physical location. And so what prejudice might look like is a negative attitude potentially toward that event, or maybe a negative attitude towards people who might attend that event because I have this initial thought of mental health does not belong in the workplace. It does not belong here. And then we have discrimination, which builds on it. So then this could look like potentially someone engaging in some bullying behavior towards someone who attended the event or reports experiencing mental health challenges. This could look like teasing. It really has a domino effect and can heavily impact how people might actually try to access treatment. So something else that can be pretty common, again, we're looking at mental health and what can happen after a crisis. We talked about it a little bit, is burnout. So, burnout is a syndrome resulting from workplace stress that has not been successfully managed. And I should bold and capitalize that part, that it's that the fact that we have not been able to successfully manage it. Let's normalize that workplace stress does happen. Even in your happiest work environment, stress is something that happens, and actually, our bodies are naturally ready and equipped to deal with stress, right? Like our bodies know how to absorb that impact when the stress starts to build. It can absorb the impact of the peak and the climax of stress, and our body knows how to crescendo and kind of fall out of that stress. But what happens with burnout, though, is that we absorbing that stress, my body's feeling it. I get to my peak, and then I never let my shoulders down. I never let my body relax. And that just builds and builds and builds and leads us here to burnout. So, some specifics that can characterize burnout in that experience and what we can maybe look at or look for. So, maybe we see feelings of energy depletion among among team members. So, if someone is feeling like they don't have the same energy at work, maybe someone used to be really outgoing, like to hold different team events, connection events. Maybe they decided, I'm just not doing that anymore. I used to hold like a team happy hour or a team get together, and there's so many other things. I'm not really going to worry about that anymore. It doesn't bring me joy. We also might see increased mental distance from our work. So we might have someone who describes when they say, I'm going through the motions at work, I'm going through the motions in life. That's what mental distance can look like from our work. We also might notice some negativism or cynicism. And I caveat that to say that, of course, we might have that one person on our team or in the workplace who loves to use satire, crack jokes. Maybe they're a little cynical. But when we start to notice that that's the norm, that that person is always negative, or maybe it's impacting others, and then they start to feel negative about the workplace and the work they're doing, that can lead to burnout. Not only for that team member who's supporting and listening to this person who is engaging in that cynicism, but also for the person who is sharing that cynicism or that negativism. And then we can also see reduced professional efficacy. I mean, if I'm having a mental distance from my work, if my energy is depleted, I might not be as sharp as I used to. I might miss little things, which could potentially lead to some ethical errors in the work that I'm engaging in. Now, let's talk and say why mental health matters in the workplace, because we've talked about what is mental health a little bit. We talked about what can impact us actually getting care, what are different diagnoses, and let's just really reiterate and drive home why mental health is so important in the workplace. Well, when we actually focus on mental health and how it can really drive some positive outcomes, we can see increased morale from team members. So we can have employees who now feel valued and feel supported because we say, hey, we're acknowledging that mental health exists. We're acknowledging that there can be challenges, and we're here to support and to help into whatever way that might look like. We can also, when we invest and recognize that mental health does matter, is that we can see improved retention. Mental health programs are actually proven to reduce turnover, which we're going to talk about in a slide when we give our real world stories, but it's proven to be able to do that. We can also see boosted productivity. So we can see reduced absenteeism, maybe in those groups who might be feeling stressed a little bit harder. We're going to notice that they're coming into work because we care about their mental health. We have an open space and be able to give them breaks during their work and that flexibility. And we're going to notice that people are more present, excuse me. So we'll see a decrease in that absence that we were just talking about previously and that disconnection from our work. And investing in mental health it actually promotes some cost savings too. So we'll typically see a return on investment on mental health programs. It's actually $4 for every dollar invested. And this is reported by the World Health Organization. So let's talk about two real world success stories and how investing in and how focusing on mental health, which invests in their people, how it actually helped their team. And then that also trickled to then affect their organization as well. So we have Washington County School District who started utilizing TAVA services during the pandemic. And this is, again, it's a school district which we know is heavily affected by the pandemic. And how are teachers, educators, leaders, how are they going to be able to reach their students and connect with their students, which heavily impacted mental health. And so what their school district noticed is, I mean, if we're going to be able to support students, we need to be able to support employees as well and to help them to succeed. And so what they noticed is a higher retention rate by taking a look at and investing in mental health supports for their team. So what they noticed is actually they had a 55% reduction in turnover when they invested in mental health. Again, that is 55%, which is pretty huge. And then we have Ogden Clinic, where they unfortunately lost a team member. So they had a violent crisis, which was due to a fatal accident. And we were able to provide support for their team, which helped their team to remember that they do have support. As leadership, they do care, and they were able to utilize that service. And what they have seen is that they've had double the utilization than previous EAPs when they partnered with TAVA to be able to provide that support with their team, which is pretty cool to actually see the real numbers in the stories. So now we're going to start talking about the practical strategies. So, just a reminder of things that we might see if our team is struggling, because after this, we'll talk about psychological safety and how can we create it. But just reminders so they can really key in what should I be looking for if my team is struggling. So, if we're seeing increased absenteeism or increased tardiness, we also might hear team members who are talking more about physical ailments like, gosh, I have a headache. I'm so exhausted, or maybe I'm having more migraines. Potentially something to look at. If you work in a remote environment, maybe your team typically had cameras on and audio on for your meetings. It was pretty open. If you start to notice that less people are doing that, maybe that's a sign of struggling. Maybe that's a sign of we need to try to re-engage the team and keep them present. If we notice there are frequent conflicts, maybe there's this underlying tension among different team members, that could be a sign that your team is struggling. If we maybe see some avoidance of challenges or resistance to taking on new tasks, because again, after a crisis, we need to be able to rebuild and continue to move on. If we notice that people are really resistant to that and they're not open to the change, maybe there's a sign that they're struggling and maybe they need some mental health support or just support with their well-being. If we also maybe notice a negative attitude or low morale spreading across the team. We talked about that example of that employee who has some cynicism. So maybe that becomes a chronic problem within your group. It's maybe a sign that your team is struggling because maybe that foundation of support just wasn't there initially. And if we notice that team members, and this is great for us to notice as leaders or people who manage a team, if we notice that people don't really want to give feedback or actually share their concerns openly, maybe the team is struggling. So that leads us to psychological safety. We mentioned it very briefly, which is important to have in that pre-planning before a crisis. It could also even be helpful after when you're trying to establish and you're doing your assessment and saying, maybe we need psychological safety here, but psychological safety can be really imperative. So it's the belief that individuals can express ideas, ask questions, and share concerns without fear of punishment or ridicule, excuse me. So there has to be a foundation of trust. There has to be a foundation of innovation and collaboration within a team to be able to establish and to continually engage in a culture that focuses on psychological safety. So I'm sure you're thinking like, well, what does that look like? Because psychological, do I need to be a therapist or a mental health expert? Absolutely not. It's great to be able to engage and utilize partners to support you in that, but you have the ability to, and the power to do it as well. So, some of the components and the ways to be able to build a culture of psychological safety is being able to have that open communication. So, being able to lead with openness when communicating and also vulnerability. So, utilizing those transparent communication skills and being able to show humility when speaking with teams or even speaking to leadership as well and kind of showing them what that psychological safety could look like. Normalizing questions is a big one. So, being able to normalize that this is a learning environment, we accept and we love that you ask questions. Something that I think is so simple that we sometimes forget to do is just validate that someone even asked a question in the first place, because sometimes that could be scary, right? So, being able just to say, thank you so much for asking that question, or even saying, wow, like I hadn't thought of that idea in that way. Let's talk about it further. Or let's schedule some time to be able to think this through a little bit. You know, that shows I heard you. I think it's cool that you're coming up with something new, and I want to invest in this a little bit so that you can feel invested in as the employee. Also, reframing. So, being able to change the language, change the narrative around mistakes, and instead framing them as learning opportunities. Like I know there are company cultures that the idea is to fail fast because we want you to be able to look at this as a learning opportunity. There was not a failure, it's just an opportunity for us to see and assess what can we do differently? What can we do better? And then creating a culture of constructive feedback, which we know sometimes can be challenging, but being able to have that establishes that psychological safety. And constructive feedback needs to be able to go both ways, right? There has to be some reciprocity there. So, as a leader, or as an HR representative, being able to provide regular and balanced feedback to different stakeholders, but then being able to accept that feedback as well and to validate that you've heard it. And then also establishing some peer feedback between team members. What a great way to kind of lower the stakes and establish that safety by saying, hey, we appreciate peer feedback too. And then, of course, fostering an environment of inclusivity and respect. So, really having respect for different ideas, respect for different types of ways that people might communicate and collaborate, and really ensuring that everyone has that voice, no matter what way they need to express the voice, but being able to meet their needs and how they want to do that, and ensuring that you're truly hearing them. We also want to be able to support risk taking and innovation. And so being able to ask questions like maybe what did we learn from this experience is something that can be really healthy in establishing psychological safety. And then we also want to practice it if we feel comfortable, or maybe that's even a great way to start, is to encourage psychological safety in meetings. What does that look like? Checking in, starting a meeting with saying, hey, how is everyone doing today? Where are you at? Are we feeling this way? Are we feeling that? Like, oh, the weather's doing this. How's that impacting you? How's your team? How's your family doing? And then being able to also do that through anonymous channels as well. Because, of course, we know we have teammates who are very quick to say, oh, I'm feeling this way. This is what happened over the weekend. And they feel very safe. But for team members who might not feel that way yet, being able to anonymously have them share, maybe by using polls in meetings. So now let's talk about promoting well-being and mental health at different levels. Because let's say I've established psychological safety or I'm working on establishing psychological safety. Let's look at maybe some leadership practices, team engagement, and structural supports that again can reinforce that message of well-being and psychological safety. A big one for leadership that I'm sure can be difficult for people to do is to model healthy boundaries. A big one, a great example here is being able to actually model the limit of after hours communication. Because what we can say is that if an employee noticed that maybe their leader, their manager, their boss is typically messaging them after hours, they're going to think that they need to respond. But let's say that maybe as a leader, that is your time to catch up on messages. That's when you prefer to look at emails. That's okay. But that's when open communication can be really cool because you can say, hey, actually, the evening is when I prioritize sending out these messages and letting them know I don't have any expectations for you to return that message. I will not send you anything in emergency after hours. I just want to let you know that that's how I work with my flow. I might not answer your requests in the morning, but I get to them in the evening. And so that's again modeling that healthy boundary because then that employee can say, great, I love to respond in the middle of the day and in the morning. So again, there's reciprocity and being able to model healthy boundaries even as a leader. And then also being able to lead with empathy. So being able to show understanding of different challenges that someone might have. You don't have to have experienced the challenge. You might not have any relationship with the challenge, but you can at least say, like, I understand how this can be difficult and giving someone space to be able to do that and creating space for that one-on-one to have conversations like that. Now, if we're looking at team engagement, we want to be able to recognize achievements. It's a great way to promote well-being and psychological safety. So, of course, being able to acknowledge, yes, major accomplishments, we've reached our KPIs, like let's assess and let's do something new, but also small wins. Maybe it's that someone has had a hard time being able to figure out how to troubleshoot something technical on their own. And then one time they did it and did not have to ask the team. That's huge. Right? Like, isn't that a big moment? It's like, yes, you know now how to be able to send this specific file. Great. So recognizing that is something that's great for morale, is great for team building, and it's also going to promote someone's well-being. And two, we can also have and schedule regular check-ins, maybe having regular one-to-one meetings, or maybe that could potentially look like on the team level, having team check-ins that have nothing to do with work things if you have that time, but it's a 15 minutes to say, let's have a lunch together. Just being able to really intentionally utilize time in that way. And then structural supports, okay? So being able to really ensure that there's physical and emotional safety at work. So, really being able to ensure that your workplace is conducive to open dialogue. Let's say that maybe you're at a physical location for work and maybe you're spread out amongst different areas of a building. what's going to be really important is deciding what's that intentionality around what communication is going to look like. Do we say like, oh, we're going to keep communication on Teams or on Slack, but please feel free to go visit people on their floor. That's fine, but there needs to be clear expectations and intentionality around that. Now we're going to end with talking about teletherapy and how it can truly help and support your team if you're on this journey of I want to have wellness for my team. So, teletherapy, just in general, to define it, it's a type of mental health care that uses technology to provide therapy sessions remotely. And you'd be surprised, actually. So, as of 2024, approximately 75% of mental health providers offer teletherapy services. And actually, most people prefer, it's looking like in studies as well, to attend virtually instead of engaging in traditional in-person therapy. So there are a few reasons here as to why someone might want to choose teletherapy over in-person therapy services. The first one would be convenience. It's not only convenient for the therapist because they're able to schedule as they need to based around what other priorities they might have or if there's travel, but it's also convenient for the client. Maybe you have a policy, and this could maybe be a part of your like, I am investing in well-being, I'm listening to people's needs. You have a policy that says you can take an hour for therapy each week, and that can just be a part of your time. You don't have to put in PTO. It's okay. Just put it on your calendar as like a block of time, and we will respect that time. It's convenient for them then to be able to meet during their workday. It also could be convenient because maybe someone needs to meet at night after they put their kids to bed, or maybe it's on the weekend, maybe it's early in the morning. But again, the convenience for teletherapy is unmatched when you're looking at that versus in-person therapy. And then you have accessibility just in general, right? Teletherapy removes all the physical barriers that it takes to getting to an in-person therapy session, whether that be the traffic, whether that's the parking if you live in a pretty metro area or a highly populated area, or potentially maybe you experience some form of disability that affects you being able to drive or to access public transportation. Teletherapy removes that barrier for you. Also, cost effectiveness. Because individuals are able to use their insurance, teletherapy can be just as, if not more affordable than in-person therapy services. Then we also have the biggest one is comfort, which is important because research shows that when clients feel more comfortable with their therapist, when they've established that rapport with them, they're going to actually see better therapeutic results. But comfort is big here because then people are able to utilize their safe space. So maybe it's meeting in their living room. Maybe it's meeting in an outdoor space if their weather permits that. Maybe it's being able to walk and doing teletherapy via a phone, which is also permissible. Or maybe it's chat therapy because that's what they have time to do and that's what's safest for them. But again, just reinforcing that there is comfort in being able to have teletherapy services as well. And not only is it really accessible and convenient, teletherapy can also be tailored for support for really anyone that needs it. So you might have someone who has more short-term care needs. And whether that be because maybe they have a short-term care model of maybe 3 to 5 sessions that they can utilize, or maybe their problem is just really acute. Maybe it's adjustment disorder. They need help dealing with some impact after a crisis. Well, teletherapy can do that. You can have short goal focused therapy, really solution focused therapy, and be able to be successful. There's also the option of long-term care with teletherapy. So maybe someone needs those consistent therapy sessions for 4 months or 5 months or 6 months. Maybe they're exploring some past trauma, or maybe they're trying to cope with their anxiety that's chronic or depression. Either way, long-term care is also an option. And then you have immediate support. So if you have an employee who is in crisis and needs counseling, or maybe it's a whole organization-wide crisis, you would be able to lean on teletherapy or lean on therapy just in general for someone to be able to come in and support your team, which has to be some great reassurance as well for you as an HR leader. So, next steps. Something that we have as a resource here is our crisis support book. And so, what it does is that it helps with being able to plan out how to help your organization through a crisis. And it also offers resources. So, it reviews a lot of what we talked about here today with many additional steps. So, please feel free to visit this link to be able to sign your email up, and then you'll be able to have access to this template as well. Well, everyone, that concludes my time on the content that we have. Are there any questions that you have? Any comments? Anything that would be helpful to share?
And for those who maybe don't want to ask a question on Q&A, the chat is open. So you can also chime in there. But Alicia, thank you so much for this. This was incredibly insightful. And even though I helped put it together, I feel like I learned something new. So this was great. We will be sending the crisis guide, the slides, as well as a link to the recording to everyone who attended, as well as those who weren't able to make it today. But if you have any questions, feel free to always reach out to us. We're available via email, through DM, on social media, really any means. So thank you all so much for joining us. Thank you, Alicia, for hosting. And we hope you have a great rest of your day. It looks like we have one question real quick.
Awesome.
Um, so the question is, what if we do everything listed in the promoting well-being in the workplace, but we still get signs that the team is struggling? Great question.
That is a really good question. I would then want to look into and probably assess with the team. Well, if we've done all these things on this list, which this list is not exhaustive, right? It's not everything. I'd want to assess the team. Let's get out an anonymous survey, or if people are really open and being able to have one-to-one conversations, but I'd want to hear it directly from them and saying, this is what we've done. What do you need more of? Like how, let's put out that pulse survey to be able to draw that information because as much as mental health experts and different people who really take a look at workplace culture, we need to talk to the people. And that's what it's really about when we're trying to balance employee needs and also what's our business needs as well. What do they need specifically and how that lines up with strategy.
That's great. And if you're curious and looking into, how do I actually launch an employee survey or anything that we actually have a resource for that where we built a survey that you can just copy, send it out to all of your employees and be able to collect all the data. It's available on our resources, but I can also drop a link to that in the email that we send out. All right. Well, looks like there are no other questions. So have a great rest of your day and thank you all so much.
Thank you. Bye, everyone.
Bye, everybody.